Hello guys, my name is Itisama Usi and I will be talking about Yaws. About 75% of people affected by the disease Yaws is mainly children under the age of 15 living in poor communities of Africa, Asia, and Latin America. This disease is mostly found in warm, humid, and tropical areas and affects the cartilage, bone, and skin. To be honest, I have seen this disease many times before, but never knew what it really was. I have touched people with this disease not knowing it was transmitted by skin to skin contact. Don't worry, I was vaccinated. To eradicate this viral disease here, people need to know the history, stages, and procedures used for the treatment. In the 17th century, the term yaws was commonly used when a Dutch physician, William Piso, provided one of the earliest recorded clinical description of yaws in South America. In Ceylon, 1905, a physician and an expert in neglected tropical disease, Aldo Castellani, discovered the spirochete in the osses of patients with yaws. The spirochete bacteria Castellani discovered is called Treponema pallidum peteneum, or T. peteneum for short. Castellani did not assign T. peteneum as the cause of yaws until he learned the discovery of the syphilis agent Treponema pallidum or T. pallidum by Sheldon and Hoffman. In the British journal Lancet, article Yaws, wrote by Mitja Oriol and her colleagues, states bone changes typical of yaws have been found in skeletons of Homo erectus in Kenya dating from 1.6 million years ago. The phylogenetic analysis verified Yaws subspecies as the oldest treponemal disease and demonstrates that Beagel and syphilis subspecies evolved afterwards. Sorry. Also stated by Mitja Oriol and her colleagues, the genetic data used to build the phylogenetic tree are scarce because of the few available strains, and some evidence suggests a fairly parallel evolution of the three subspecies. Therefore, conclusion about how old yours is and where it came from should be made with caution. Now that we know a bit about the history of Yaws, let us discuss the stages. Yaws has four main stages: the primary, secondary, lenient, and tertiary. In the primary stage, the first sore, also known as mother yaw, develops at the point where the spirochete penetrates the skin. The secondary stage is when the spirochete will multiply into more sores, even if the primary stage is present. How J. Tim, author of Yaws Causes, Stages, Symptoms, Diagnosis, Treatment, and Prognosis, published in 2020 states, mother yaws may evolve either into an exudative pilonoma 2 to 5 centimeters in size or degenerate to form a single non-tender ulcer covered in yellow crust. The leg and ankles are the most common sites affected. In the secondary stage, patients will develop lymphadenopathy and secondary lesions, which at times are painless and filled with pus that burst, forming ulcers. During the lenient stage, there are no symptoms. However, bruises from the previous stages can reoccur. Movement of soft tissues, bones, and joints are affected by the spirochete infections during the last stage of Yaws. Davis Charles, author of Yaws Symptoms, Diagnosis, and Treatment, published in 2016, wrote, in the tertiary stage, yaws can destroy areas of the skin, bones, and joints and deform them with pains in the joints and or bones. The palm of the hand and the sole of the feet tends to become thick and painful (crab yaws). Even though the description of the stage sounds like yaws cannot be treated, yaws can. In fact, simple antibiotics can kill yaws. Penicillin, given by the injection is used to cure primary, secondary, and even the later stages of yaws. A type of penicillin called Vizitin penicillin G has been the mainstay of treatment for yaws for over 60 years, stated by the Health J team, author of Yaws Causes, Stages, Symptoms, Diagnosis, Treatment, and Prognosis, published in 2020. Also, oral penicillin has been proven effective and successful. According to drug.com, author of the article Yaws published in 2000 claimed if you are allergic to penicillin sold under many brand names, your doctor can treat you with azithromycin, tetracycline, or doxycycline. In summary, knowing the history, stages, and procedures used in the treatment of yaws can help eradicate the disease yaws. It may take time to annihilate yaws due to the lack of resources in third world countries, but it will happen because it was eliminated before. Thank you.